Next, we have Dr. MITA Joshi, who is going to talk about smartphone apps in ophthalmology. So, smartphone apps, everybody has a smartphone. You can use it immediately. Just note down which apps will be useful for you. Start using them. Over to you, ma'am.
Thank you, John. Thank you, AIOC and Chairman Scientific Committee for giving us this opportunity. Let's start off with a small quiz. Which is the latest Android version? You want me to do this or you'll be doing from there? Okay.
Latest Android version?
I don't use Android.
Okay. Even I don't remember. I guess it is Nougat.
No, we have
No,
moved forward.
I have not updated my Android. Okay.
Okay, I have got it from here. Right. So as we all know, these are like named alphabetically, and now we are on the snow cone. And for the this thing, Apple and all, we have the 15.5 version now. So knowledge is power, and staying abreast with technology is important. Apps, as we all know, are applications as a self-contained program or piece of software designed to fulfill a particular purpose. So you can download it on your phone and have a varying content and function. Apps in ophthalmology we can have for medical education, journals, conferences, patient utilization, and imaging. Apps for medical education are many, and we'll just look at one of them, which is the eye handbook. This is one of the Cloud9 presentations and has a lot of features which can be used in your day-to-day practice. Like you have diagrams, consent, kind of pro formas which you can use, patient education, testing, and visual symptoms. It has the Amsler grid, color vision, contrast sensitivity. So you can use it in your emergency or a bedside examination. The Worth 4 dot test, especially for near checking. Color vision, we all have the black book with us, but sometimes the pages get faded, and then you have this very useful option. The only limitation is you can't define the color vision deficiency which is there, but at least it gives you a general idea that there is a presence or absence of the disorder. It has pediatric optotypes, and the best thing, if you give to your to a kid who comes into your OPD, give him an iPad or something. They'll be very cooperative, and you can check them at the same time. It also gives you laser settings, so you can just refer it to it anytime you want. There are additions, amplitude of accommodation, glaucoma risk calculators, IOL calculators, which are connected to the Warren Hill site. You have eye diagrams in it, which you can explain to your patient. There are symptoms of various disorders which can easily be understood by patients. Another one is ophthalmology, so it is kind of a ready reckoner which gives you all the disorders, and you can just have a topic and get a kind of brief update on it so that you can refresh your knowledge. Draw MD allows you to draw on pictures, and you can save your patient's images and data. This is one which I found very interesting, especially for the OT staff. You can teach them to differentiate between instruments which you have in your OT and refresh your own knowledge at the same time. iTube, you have most of the videos playing where you can update your knowledge. Glaucoma risk calculator, this is based on the OHTS trial, so you can enter the data and just find out the risk of the glaucoma which your patient has. Acronyms are also like very confusing some of the times, so you have TLA ophthalmology and OE acronyms which can guide you. This is one app which is validated. This is one of the debates where you have there are many apps, but they have to be validated also, so that you can judge the decision which is given. So this gives you visual acuity. You can do it at 1 meter and 2 meter, and it has the e-chart, so it is for useful for literate, illiterate persons both. These are on iPhone, the 9 gaze, which allows you to check the gaze of the patient and have a image at the end. Parks 3 test. This one was always confusing, and you can have an app at least so that you can diagnose. There are simulators also available, strabismus surgery and other surgery simulators. phase 2 gene, this has the Western data. I don't know how much we have for our setup. And dose checker for hydroxychloroquine and cataract mobile. You can test your hand-eye coordination with this app. IOL calculators, Columbia University SRK2. You can have the effective lens position calculators, and LRI calculators are also available. Toric IOLs, we have quite a lot of apps with Indian and foreign contribution for this, including Dr. Saurabh Patwardhan, Dr. Girish Jethwa, Dr. Mukesh Dholakia, and Dr. Graham Barrett. Medical journals, you can have all your journals online, so like the AJO, the IJO, Will's Eye Manual, Atlas of Ophthalmology. Conferences, we all are now very familiar with this. This was way back when the apps like just started. So you can have your sessions online, you can just see what's going on in which hall. These are few important apps which you can tell to your patient. So Sightbook is for low vision aids, and what you can have is it has an AMSLR in it, so the patient can do a home check of the AMSLR and get back to you with the progress. He can just send the screenshots to you, and so you can see how things are progressing. Eye drops, this one is for your patients who are like geriatric, living alone, there's nobody else in the house, so they can have an eye drop alarm to tell them that the time is now to put in the eye drops. Be My Eyes, this is for the visually handicapped. It sends out messages, and any person who is online can help the visually handicapped person at that time. Eye drop alarm, again same like My Eye Drops. Seeing AI, also it uses AI to describe the surroundings to the patient. We have Roshni Currency Recognizer, Vikas and Dignify, which are again developed by Indian Institutes LVPI. So it can be helpful to the patient. This is letter hunting, so you can give eye exercises to the patient. Embryoscope, embryo care, so you can give the simulation to the patient at home itself. Apps for imaging are already covered, so I think we can just go through this at a faster rate. You can have your own app, you can design your own app, so that patient can be in touch with you through the app, fix appointments, give a feedback. Handy apps, like this is one which we found very useful, voice to text apps, speech notes or voice notes, because you need to have one person sitting and typing around you, and sometimes that is not possible, so you can just use these apps. My OPD Practice for your practice management. iGIFs you can have for patient education. I know Tamil and I know you have Bangla also now, right, John? Yeah. So this is very important because first 6 months of your fellowship are gone in learning the language, so you can use this app. And organizers also, which we can use for managing conferences and the logbooks and everything. Create your own app, free app creators, AppCat PR, Cataract Mobile. This one was by my son. He used this thing, imaging, so that the image of the anterior segment can be sent to the doctor, and you can just look for Bitot spots and other vitamin A deficiency disorders, especially for school children. Certain issues, patient privacy, sharing information and confidentiality. Cell phones and OT are now a norm, but then they carry a lot of germs also. We have the latest NMC guidelines now coming up, which may hamper all these things. Authenticity of the app and FDA approval or validation of the app is also important before you use it. Thank you very much.
Thank you so much, ma'am. So that covers a lot of smartphone apps which all smart people will be using. I hope you got the list of apps and the ones which are specifically useful for you. And that brings us to the end of the session. I thank all my co-instructors who have